So welcome everybody. Thanks for coming on today. I know some of you may have been on Friday, just to let you know that this is the same presentation. So we are very grateful to the team at Foundation Health Partners who are putting this together for us. So we are good, Susan.
Okay, thank you. So today we have Dr. Michelle Nace, who's a pediatrician and our medical director for pediatrics at Tanana Valley Clinic. We may have Clint Brooks, who is our COO. He's our incident command leader. If he's able to attend, he will come in later. We've had a team from FHP working on this education. So FHP is Foundation Health Partners. We're a nonprofit organization in Fairbanks, and we are Tanana Valley Clinic, Fairbanks Memorial Hospital, and Denali Center. We have about 100 employed providers and about 1,700 employees. And so as a team, because it's our industry, we obviously responded to the COVID pandemic and have really kind of lived through these last 5-6 months, adjusting and making changes to all our operations and really learning what the landscape is, particularly in the community of Fairbanks. So today what we have is a presentation. It's a PowerPoint, and then we'll also go to video where Dr. Nace will give some demonstrations on some of our PPE, so you have some education. So essentially what Terry requested a few weeks ago as she was planning for everybody to return to work was just seeing what resources we had at FHP to help you before the school year starts. So our plan is to give you some information. I'm sure you've seen a lot in the media and a number of other venues, but we're trying to just put it all into one presentation. We will have this available to you, emailed out after, and then also have the opportunity to ask questions. If you have questions through the presentation, you can use the chat. We'll probably be able to see those a little bit as we do the presentation, but definitely at the end of the presentation, if you have questions, we can access those through the chat. If we're not able to answer the questions, we'll be sure that we get them answered to the best of our abilities and sent to Terry after the presentation. And so with that, our training will begin. Let me pull up our PowerPoint and start. Oops. So what we titled this is COVID-19 advice. And the reason that there's an asterisk is because it's such a changing climate. It's a new disease. We don't have the resources to be able to consult or reference like we would in any other area in healthcare. So there's direction today. It could be different tomorrow. It could change in the next week. So we're pivoting all the time as we learn more and more and making changes. And with no further ado, Dr. Nace will begin the presentation talking about the clinical aspects of COVID-19.
So I am Michelle Nace, as I said, and I'm a pediatrician here in Fairbanks, and I've been working with the school district to kind of help get us all more prepared for this upcoming school year now that we have this new novel virus that has kind of entered the earth and entered our vast ability to go back to school. And so a couple things I want to acknowledge before we started is one is that we all have a goal of eventually getting back to in-person learning. When that actually is going to happen for particular students, teachers, staff, et cetera, down the road, not all of that is known, and we can't make the definite plan until we have more information and see how the virus is going, see how the response is going, see how it goes in the community. So as much as we'd like to have here are all the answers, just as Susan said, we don't have all the answers. We know that coronavirus, this is a tricky bug. And just when we think that we know what we're doing in one direction, it gives us another instance and we're off to this way. So we try to make these plans, we try to plan ahead, and then COVID steps in and pulls us a different direction. So that can lead to a lot of frustration. It can lead to feeling like, don't these people know what they're doing? It can make you feel like you're out of control. And if you don't feel some aspect of that, you probably don't have a full picture of what's going on. There's going to be confusion, there's going to be frustration, there's going to be misinformation, there's going to be a lack of information, there's going to be what we say, wait, you said that last week and now you're saying this. So the thought process is that we really have to be flexible. We have to be nimble. We have to be able to adapt and say, The thing we can expect is that things are going to continually change through this school year. And with all of the information that we're getting, we are going to be readjusting our plan and going in a slightly different direction. We have the goal of getting kids back in the building and in-person learning. We know that it is best for kids to learn in the building, but we also have to balance that with the safety of the community and the safety of our children and the safety of our staff who is working there. So trying to put all of those pieces together makes it really difficult. And those people who are in the decision-making bodies, they are having a tough road. And so any support we can get and feedback from people who are working right in the schools and saying, hey, this could be done a different way. We want to hear from you. We want to be able to say, oh, you have that great idea, share that with us so other people can do it as well. So in order to get through this better, we need the input of people as they have new ideas and new ways in which to manage this. So that leads me to talking about coronavirus. So what is coronavirus? Coronavirus is a type of virus that we've already knew existed. However, this particular one that causes COVID-19, we had not yet heard of or aware of until just this end of 2019. And that's why we call it a novel virus. It is new to us, and we had not yet experienced it. But it's here, it came, we were aware of it, and we started to see and hear more about it over January, February, and by March here in Fairbanks, we definitely knew about it. And that's when it really impacted our everyday way of life and living in schools. So go ahead and go to the next slide. So the first thing I'm going to talk about, go ahead and go in one more. There's a couple ways in which different people understand. Do you have these actually? You can play them. Is this the one you were talking about?
Mm-hmm.
There's different ways in which you can kind of explain COVID virus, and some are better for certain ages. But this is an example of a couple things on YouTube, which helps explain COVID virus in children's terms. So we're going to try to play one and just kind of show you different ideas in which to help your students understand coronavirus as well.
This is the, whoops.
So when we do play this, there's a warning that comes along with them. Some of them are catchy little tunes that will not leave your brain as long as coronavirus still exists. And what it just kind of shows is there's different ways to make help a child understand it in a way that's not. What you can see is that YouTube is full of little explanations and
Sorry.
Right.
Jeez. I can't pull.
See what I mean? Why you won't be able to forget it? We can't even get it off our screen.
There you go.
There you go. So just in your own exploring, and you'll find different areas that talk about COVID-19 and different ways in which you can explain it to the children, depending on their age and their developmental understanding, can make a difference. We as adults know that this is not a comfortable thing to have in our existence. But there are certain details that children can't wrap their minds around that we might, but we can still explain it to them in a way in which they might better understand. Go ahead. So I'm first going to go through some details about, one is like, how is COVID spread? We've heard it again, the hand washing 6 feet apart. This is because we know that the virus is spread mainly through person-to-person contact. It is people who are in close contact with each other and we use the number 6 feet. 6 feet is that we are figuring that by 6 feet distance between that, how it is spread has less likelihood to get from one person to another. So I'm going to talk just a little bit on a side note about how it's actually spread. So what we know is that when we talk, when we sing, when we cough, sneeze, yell, that are from our mouths come out tiny little droplets that can be transmitted through the air and potentially to other people. Now, how that happens, you'll hear things about aerosolized and droplets. So these droplets that come out of our mouth are a certain size. Now, because of a certain size and how they are, they eventually kind of drop down to the ground or to a surface that they're on. And the majority of them will do that prior to this 6 feet. And that's where the 6 feet comes. You'll also hear about like, but wait, aren't they aerosolized? So you can kind of picture aerosolized as the tiniest of droplets that are small enough that they hang in the air a little while. And especially at the beginning part of when we first started hearing about COVID-19, we were hearing about, are these droplets? Are these aerosolized? And that's where the difference in masks came up. Over time, we've saw that the majority of COVID-19 is spread from person to person by droplets. But we can't say that there are some that go in the aerosolized, which means they're small enough that you could, they float in the air just a little bit longer. So that brings up the question of masks and the different types of masks. So a little bit later, I'm going to show you the difference. Go ahead and go back just where you were. I'm going to show you a little bit of the difference between the two masks and why wearing one versus the other one makes a difference. But some take-home points about spread is that although a person might not have symptoms, they can still potentially spread the virus. And that's in more than one different kind of scenario. People before they might show symptoms of COVID, in the about 2 days-ish before they show symptoms, have still shown that the ability to spread the virus to other people. So those people are like pre-COVID-19 in that time, well, they've been infected, but symptoms have not yet developed. But even more recently, we're seeing more and more people can be asymptomatic and carriers who might not develop symptoms, but still have the ability to pass this virus on. And that's where the importance of universal masking, because you don't know if you're in that pre-COVID-19 time period where you just haven't developed the symptoms yet and you're going to, or if you're one of those people who may be an asymptomatic carrier, and although you don't have symptoms, you still can spread. So by wearing the mask, you are protecting others around you. Now, later, more recent data is also starting to show true advantage for those wearing a mask, that it also protects you as well. You from getting some of those droplets in, and you from not touching your nose and mouth as much as you might have in the past. So masks are important for mainly protecting those around you, but yet there's also some data showing protection of you yourself by wearing a mask. Okay, go ahead. So there are some other ways in which you can get the virus. And if you think about when I was talking about when you talk, sing, cough, sneeze, those droplets come out and where they fall down. Now they can fall down on other surface areas as well. And so if I'm talking over and there's a table below, they can hit the table and have the virus on it. Then somebody else coming by and touching that table on their hand, if they're then to touch their mouth or nose or eye area, they can potentially give the virus to them, to themselves as well. So it's not only just by what's coming directly from my mouth, it's where those droplets may fall and who else might touch them. And that's why you're gonna see the emphasis on cleaning and disinfecting surfaces to get the virus number down to not infect others. Go ahead. So if we go back, you'll hear again the review of the 4 main ways to prevent illness from getting others exposed to the virus. There's wearing the mask, which we've talked about, covering your nose and mouth when you're on there. There's hand washing. By washing your hands, should you accidentally touch the table or touch a surface that's been contained by a virus, and then you wash your hands with soap and water, and that's for 20 seconds of using soap and water. And if that's not available, using hand sanitizer. That helps protect you from giving it to yourself. It helps protect others around you by not spreading it to another surface or to another person. And so those two, by hand washing and masking, are 2 of the most effective ways we have to protect each other. Cleaning is also important by routine cleaning what we call high touch areas, like doorknobs, tabletops, keyboards, other things that constantly have hands there, by keeping those areas cleaner and disinfecting them regularly, that helps protect others as well. And then there's social distancing. Maintaining that at least 6 feet from those around you is a very important, especially when you're indoors. Prevents the direct spread of COVID-19. Okay. So when we go, I'm just going to go back up into a little masking again. To reiterate, even though you don't feel sick, you still could be spreading COVID-19. So the mask is important to another. But there are some people who cannot wear a mask. The biggest group in there are the children who are under age 2. They cannot developmentally understand it. They can't adjust it and move it. So it's not a current recommendation for children under the age of 2. There's also some medical conditions that are not compatible with wearing a mask. But those conditions are few and far between. It doesn't mean that everyone with asthma, everybody with a breathing problem should not be wearing a mask. It just means that there are a certain population that shouldn't be. So we do know if someone's unconscious or incapacitated or otherwise unable to move, they should not be wearing a mask. And even though you have a mask on, that's not a get out of jail free card for not respecting the 6 feet of distance. You still want to have that because masks are not 100%. Go ahead. Hand washing has to go around there. People will ask about hand washing versus hand sanitizer. The best way to get the germs off your hand is soap and water, 20 seconds, and then drying your hands. Why hand sanitizer is also good, it is not as effective as hand washing. But what hand sanitizer is quicker and more readily available and easier to do with children. And so hand sanitizer should be readily available as a substitute, especially when hand soap and water are not available. Go ahead. When we go again in the details of cleaning and disinfectant, and sometimes those two can be used for another and they mean something different. Clean is when you're taking and you're rubbing or you're cleaning off dirt and debris. Like when you have something on your shirt, a spot, and you rub it, that's cleaning your shirt. It can be removing dust off of a table, whereas disinfectant means actually inactivating the viruses and bacteria, and that's by using a EPA registered disinfectant that it's known to work against coronavirus. Go ahead. So social distancing, again, to reiterate, as much as you possibly can, trying to keep that 6 feet away protects not only you, it protects the other people around you. So that doesn't mean the people in your household and in your social bubble that you need to do that, but trying to keep 6 feet away between you and others. Now, you'll see some data and some recommendations regarding school will say between 3 and 6 feet, because they're trying to balance getting our kids back into school as well as maintaining that 6 feet. The majority of those droplets are going to fall in that 3 feet, but we can't be sure depending on ventilation, depending on what else is going on, temperature, how far it goes. So we know 6 feet is a safer distance, but at least getting that 3 with the goal of getting to 6 feet is the recommendation. Go ahead. So let's talk a little bit about symptoms that you see with COVID-19. So tricky about COVID-19 is that when we first started hearing about it, and more so in March here, you'd see things like fever, cough, shortness of breath. And then shortly after we start adding different features like fatigue and body aches, and headaches. And then this original one that we hadn't seen too much is a loss of taste or smell. And then other ones are adding it to it, sore throat, congestion, nausea, vomiting, GI kind of discomfort. It pretty much covered any kind of illness known to man, which made it incredibly difficult to tell this one from others. Also, the twist to it is that kids and adults sometimes have a different disposition of symptoms. So we know that with kids, about 50% of them will present with fever or with cough. But that means that 50% of them don't have those symptoms. And some of them have more GI components, meaning like nausea, vomiting, or diarrhea. And so it makes it a difficult one to know exactly what you have when you have these. And you can kind of look at those symptoms and they kind of fit a lot of other things like the regular flu, like a common cold, like strep throat. So it's kind of difficult to know exactly what's COVID-19 and what is not COVID-19. Go ahead. So what are some of the things that we can do? Go ahead. We talked about the mask, and I want to go over some masks with the demonstration about what some different masks are. So you can see in the pictures up, there's right ways and there's wrong ways to wear a mask. And the right way is to cover your nose and your mouth so that both what comes from your nose when you're breathing and talking from your mouth is not exposed to others. We'll see a lot of people who will pull it down under the chin or on their neck or push it up or take it off while touching the front. All of those things are not encouraged. You want to, when you're taking your mask off, you want to be able to do it from the loops that are around your ears without touching it like that. Some things that we've kind of learned here and we're going to go over. I'm going to show you a couple of different kinds. Huh?
Or you want me to take
Yes.
it off share?
I don't know what you just said.
You want me to take it off share to show them?
They can't see me right now?
Right.
Yeah, I want them to see me.
Okay.
Okay. So is when you're taking your mask off, like I was demonstrating, is taking it off by the loops here. And when you put it back on to the same way, all you can do to minimize touching it is to your advantage and to others' advantage as well. Yes, you have to pinch it up on your nose if you have the little wire thing to get it on there. But anytime before and after you do with your mask, you should be hand sanitizing. And if I had that right here, that's what I would be doing because I just touched my mask. So I'm going to go over a couple different masks and just kind of show you what you might have heard bandied about, like what are the differences of these masks and why does it make a difference? So I'm going to take my mask off and show you what the first one you might heard of is a cloth mask. And these are masks that are made at home, or now you can kind of get them, and they look just like this. It's just fabric and some kind of ear loops. And so the one I have here is one that works well athletically. If you were, you just put it on and put it over your ears, and that's your mask. So this provides some elements. As you can see, air can still get in the sides, but it still gives me some droplet protection from my droplets going out to others, and it also is going to save me some as well. So then you have other masks that you might hear bandied about called like surgical masks or procedure masks, and that's going to look more like these kinds of masks. And this is what we had to had an effort that we were running low on, especially back in the beginning of the season back in March. And these are medical masks, and they are made of a different grade of material in there that has a higher protection than your homemade cloth masks. And so when I put this on again and pinch the nose, what you can see, if you can't see, I'll explain it, is there are little areas in which air can get through here. And there's little areas you can see underneath too. So although I am more protected by the material that's here compared to a cloth mask, I still have the possibility of breathing in some of those aerosolized if some should be floating in the air close by. So that's why we wanted to have our medical and our healthcare providers being wearing these, people who are in a high incidence or a high risk area to be wearing medical masks. Now, then you've also heard about the N95s, which we are definitely in shortage of as a nation. And why the difference between those are, again, I still have space on there. In an N95 mask, you get fitted for them. So they're, depending on what size your face is, you are actually fitted for a sizing. And so what they do is they take away the side space on the side. So if I put one on, it's a little harder to understand because the voice doesn't get out as well, but it's fitted. It goes all the way around and makes a seal and to the sides of my face so that it not only protects those around me from my droplets and my air, it protects me from your droplets that are around there. So it's a more secure. The disadvantage, it's a little harder to wear. It's a little harder to breathe in. You can feel there's something more there. It's firmer on your face, and air exchange doesn't quite feel the same as when you're wearing the other ones. But you do get more protection by wearing this N95. But again, because of the shortage, these are ones we're saving for those in the medical field to use because they're in higher risk areas. So one thing I also wanted to point out is some little inventions that you also might use. So if I'm wearing a mask, or one of your students are wearing a mask, when I take it off, like when you eat or drink or you're doing something else, there's a little thing that we did. And this is just like a little box like you might get a hamburger in. And what we have done to save masks is when we were taking off our N95s, we actually would store them in the little box so that when we were done eating, then we could put that and use it. Now, the current recommendation, of course, is that anytime you touch it or use it, you're supposed to switch masks. But cloth masks and the practicality and saving masks, this is one thing that we did to help save. So it might be something in classrooms that some way, shape, or form, and kids can decorate it, put it, have their name on it, and it helps keep it safe as opposed to lying it on the table. It's in there until they're ready to wear the mask again. The same thing with steps for helping kids wear masks. It's not always an easy thing. Some of the recommendations that they've made for helping kids is to really reward them when they're wearing it right, and to talk about wearing it right, to have them see you wearing it, to let them decorate it, to let them look in the mirror at themselves, to let them see other kids who are also wearing it, are all positive strokes to help your kid keep wearing it. Also, if they have stuffed animals or other things that are wearing a mask, that also can make this more of a reality to them and something that they're more willing to do. So that's about masks. The second thing I want to go over is some other protective equipment and just kind of show you what that looks like. So another thing we do, even though I'm wearing eyeglasses, we also want to protect eyes because that's another way in which the virus can go in. So some different things we have to protect that are some form of goggles. So we have some things that are just thin plastic that can go right over your glasses to protect. And the difference is it protects the sides, so you have less avenues from which for those droplets to go in. We also have ones that we wear that just are like regular, like almost like racquetball goggles, and they just go right over your glasses as well if you're already wearing them and you have them on, but can be reused, different than the disposable ones. The ones you might also heard about, different type of splash masks. And that's what this is. And that's like a shield. Some we call them face shields, splash masks. And that's goes right over your mask. Now, some people think, oh, this is in place of a mask. But the important thing to remember, this does not replace a mask. This is to protect your eyes and to give your mask more protection, not instead of it. So when you put this on, this is going over to protect my eyes, but to also give my mask more protection on the side, so less opportunity and more protection for me as well. But again, it does not replace the mask. It's an addition to the mask. Now, there are some that are coming out that have a pouch underneath, and I'm not sure if that's available to you or not, but there's then that can potentially augment and replace a mask, but these are not geared to replace a mask. And then the last thing I'm going to go over is some of you, depending on your job description, may have gloves in which you're wearing gloves. And this is not, the advantage of these are not necessarily to walk around town wearing gloves or to use them as you walk around doing stuff, because you can rub your eye, you can touch the virus, rub your eye on this, you can touch the virus and bring it someplace else. These are not your end-all be-all to help, but what they do is when you're directly dealing with body fluids or other high-risk types of activity where you need to wear them. So the highest times in terms of giving yourself virus can be when you're taking off the equipment, whether you're taking off the goggles or you're taking off the mask or the gloves. But there's a trick in terms of with gloves to help decrease your risk. And so one is like what you're doing is to take off your gloves. So I have my gloves and let's pretend I have virus on these gloves right now. If you to pull up and you're making like a little tent in this glove, And then you're able to pull that glove off and it's going to go into your other glove. And then this hand has not touched anything that glove did. Then to get your other glove off, you're going to go underneath between your arm and the glove here. And so you're underneath, so you're still protected. And then you're pulling that glove off over the other one, and then you're just discarding them in the trash. Then after that, anytime you're doing that, hand hygiene, and you either wash your hands or you use your hand sanitizer to take care of. So that's just kind of going over there in general. We also have gowns that I'm not sure depending on where your department, what you might be using. And these are just gowns that we put on to help protect our clothing and ourselves from the droplets as well. And then they're disposable. After dealing with one patient, then we would go and get rid of that as well. So that's another option. Okay, go ahead and go back to the slides. So going back to the mask, this just kind of goes over what we're talking about, how to use, and always use hand hygiene over. Go ahead. Washing masks, those who use homemade masks out of cloth, that can be washed right in the washing machine on the highest setting possible. That still keeps the mask safe. You can also hand wash them. There are some recipes to hand wash your masks on the internet that involve percentages of bleach that you can look up too, but you can also put them in there just in the regular laundry, okay? Children wearing it, again, to review, no one under the age of 2 should be wearing it. It's only for those who are able to understand. And as you know, it's a challenge to get even those older toddler ones to be able to wear it, and preschool age children. Go ahead. Here are some recommendations, and you can find this on the website from the American Academy of Pediatrics, AAP. Some different things that I've already discussed, putting pictures on them, making it more fun, seeing other kids, you wearing them, looking in the mirror. How do you make them look less scary so that they continue to do it in school as well? Go ahead. Hand washing. There are many different times we want you to wash your hands, and most of these you've heard since you were a child about to do. But if you ever have to ask yourself, should I wash my hands right now? In COVID season, the answer is yes, go wash your hands. But especially before and after doing things like working with food, going to the bathroom, touching your hand or face, caring for someone who's sick, those are important times in which to wash your hands. And washing your hands, 20 seconds, warm water, it takes a long time, that 20 seconds, and then drying them adequately afterwards. Go ahead. There are different ways, and these are, again, different YouTube links, which we're not going to go to right now, but you could. And what those are is just little ways to help making it normal for kids, and sticker charts and talking about hand washing superheroes and different ways to make this a positive. And that's part of their job as keeping others safe around them, that we want to do this. So finding an organized time. Okay, it's time to eat. Let's all wash our hands. Okay, we finished eating. Let's all wash our hands. Different things that you can do in your classroom to help encourage children to wash their hands. Go ahead. So we went over a couple of things already. We talked about the masks and how they protect not only those around us, but us as well. We talked about eye protection and the different ways in which we would want to keep our eyes protected from getting the virus. We talked about face shields, which go over a mask and not in place of a mask. And we talked about gloves and how the proper way to take them off and throw them away, and then perform hand hygiene. Go ahead. So there are a lot of difficulties that come along with COVID-19, and it is not an easy ask that we're asking you to help take care of our kids and help keep them safe. By keeping them safe, by keeping our community safe, we allow us to more soon get back to the community that we knew before. It will never be the exact same. There's always going to be a difference, but we certainly can move towards a safer environment if we all participated in those things of social distancing, masking when we're out in public and can't guarantee 6 feet away, keeping that social distance, washing our hands, and cleaning the area around us. One thing I also want to reiterate again is your involvement. when we first started doing and trying to find different ways in which to keep ourselves and others safe from COVID-19, it was moving and changing, and the plan and the recommendations at such a fast rate. You and the school district are now being put in the front of starting the same kind of conditions where you're going to think it's going this way, and someone's going to come up from the side with a different concern or a different condition you hadn't realized before, and now having to figure out a new way to solve it. If you see things that aren't working, if you see things that could be done better, if you have areas of concern, this is the time to raise your hand and say, I have a concern. How can we do this better? And the same point of that, it's easy when you see others making these decisions and coming down and then telling you one thing and another, to take that road of complaining, taking that road of frustration and not complying in a way then maybe that will helps the community as a whole. But that is a time that I challenge you to making that commitment of how can we make this better? Because our overall goal is to get these kids back to school, to keep the kids healthy, to keep the staff healthy, to keep our community healthy and get back on that path, to be able to go back to a life similar to what we knew before. And if kids see you doing this and being resilient and trying to figure out ways to make it work, even though the conditions are different, they too can help adopt that pathway. And so by having all this diversity, having all these changes and showing our adaptability and our ability to be flexible, we're also teaching these kids that same thing. And that's part of that, school district goal as well, as we want these kids to be able to handle adversity, to be flexible, and see that even when there's these crises like this that have us change our direction and think of new ways and solutions, that's a powerful life lesson. So trying to say, how can we use all this to also to help our kids, which are going through a rough time just as we are. But again, the overall take-home message is that if we do this and we do it together and realize they're working towards the same goal, we'll get through this stronger. Go ahead. We have a couple of the things that can help you in this process. One is the COVID-19 hotline that's been in existence since back in March that has some direction in which it gives you. There are some different medical minutes that talk about something on the FHP website to help give some more detailed information. There's also, go ahead, some sites that we've come to trust and rely on. The main one is the cdc.gov, and that one addresses so many specific questions, concerns, and scenarios regarding COVID-19. It's been invaluable in us making policies and figuring out how to get us all on the same page regarding the process in COVID-19. The state of Alaska also has a website which gives you information. And the nice thing about the DHSS website is it gives you Fairbanks and Alaska specific information about what our case numbers are, what direction we're going, what it's been the last 14 days, how it's been the last 7 days, the number of current cases. It gives you that specific, and that's available to the public to be able to see exactly where we're going. The AAP website, next one, which is the American Academy of Pediatrics, is geared for the students and the children here. And what it does is gives you a lot of helpful tips as well as recommendations about COVID times and how to, if you're not sure of like, oh, how can I talk to kids about masking, or how can I help kids with the mental health aspects of the difficulties this is. They are a great resource that speaks to, in a non-medical way that's that can be handed out to parents and speaks to them in a way which they might be able to grasp and go, oh yeah, that's a good point. I'll try to incorporate that with my child. And then, of course, your human resource department, if you have questions regarding that. This is an example of what you might see on that website, which I was talking about at the DHSS website, where it specifically gives information regarding what's going on in terms of like the number of cases, the hospitalization, what age group is the highest number of positives, where in the state has more numbers, and how old are the patients that we are seeing with COVID-19. And that changes on a daily basis, and they can, you can access that to get more of that information.
Then this is a couple more links, and then that was the last slide.
Go ahead.
So that's it.
So that kind of is a summary of what we're going through. And I'm not sure if there's any additional questions. We'll look and see on the chat and see if we can't, with Terry's help, get to some of these questions to see if we can answer those.
So Terry, I think if you want to take the question about face shields. Okay.
Well, I can take until we get Terry's volume back.
Can you hear me now?
Oh, yeah.
So we have purchased about 1,200 face shields to be able to share out with the schools. But the face shield by themselves is not going to be enough. I know that there's concern about it not being, and Dr. Nace, did you share about the fact that it was not keeping people safe by just wearing the face shield?
I did share that.
Okay.
What I see are some questions regarding cloth masks and PPE, and I'm sorry if that was a miscommunication. These are not, the cloth masks, we do not call these in the medical speaking for personal protective equipment. No. What I am saying is that they protect those around you. There has been some evidence, and more so lately, that they do give some element of protection to the person wearing them, but they're not PPE like what we're talking protective equipment like the N95 or other masks. So if that was unclear, I'm sorry about that. But I'm not a proponent of saying this is what we're using at the hospital as protective equipment. I'm just including that in our discussion about it to show the difference in that.
Great. So there was concern about the face shields again, so the not being good enough. So typically you would be wearing the face shield with a mask. There might be a couple of situations where you would need to take the mask off so that the student could see your mouth, but you would not on a regular basis not have the mask on with the shield. So we had other questions about, and you just answered that about the cloth masks. And then again, you answered that one.
There's a question that says we're provided shields, now they're not good enough.
Yeah.
And I think we addressed that saying they are good enough. They're excellent. They're just never meant to replace the mask. They're protecting your eyes and giving your mask extra protection. So the intent was never to replace the mask. That's why they have them. Now, there are some conditions where they need to see your mouth and the words form, and they will give you some protection. And so the exact way in which they're being used will depend on the audience that you're using it, the group in which you're using it.
Okay, so there was another question about the plexiglass barrier between the speech student and teacher, say with or without shield or mask. So there may be in some instances, some SLPs may have a plexiglass barrier. I'm not sure. That's why in those situations where you're gonna stand or be at least 6 feet apart, you may have the shield on so that you can do the speech lesson and then be able to, the student will be able to see you. And then when you're done with that, you'd put your mask on. And then Pat, some district-wide staff are buying their own UV disinfection machines or air purifiers. Any comments?
Is that to me?
Yeah.
I don't have a specific comment that I can say. I'm not a disinfectant machine specialist. I can say that they're out there, that we have particular ones that are medical grade that we might use, but to the ones specifically out to the public, I would imagine there's different specifications, like what size the room, how much they use, how they have to be maintained. And I don't feel I have enough expertise on all of them to say this is a recommendation or not.
So I think, Terry, that question could probably be posed back to the person who's in charge of the building maintenance. And then maybe if they need additional resources, they could reach out to our FHP team.
Great. I will put that on the list.
Okay.
Any other questions?
Bring up, while we're waiting to see if there's any more, a couple questions that came up last time. One of them was, do you recommend wearing any kind of your own kind of gown or scrubs or anything if you're in an area where you're concerned? So as I showed how we use the gowns, there are some who also will use some kind of a smock or a cover up when they're in that particular classroom. And then at the end of the day, take that off, hand hygiene, and take that one to wash it and wear a different one the next day over top their regular clothes. This allows them the flexibility of after the day to take that part off and not have their direct clothing. And my comment to that is that sounds like a very reasonable idea, especially if you're uncertain when something, you're never certain when something might happen in terms of someone sneezing or coughing or sharing their secretions. That can come your way. So having some kind of protector, it's not a bad idea. You just want to make sure when you're taking it off and that it's something you wash at the end of the day and using a different one the next day.
So you just answered part of this again. So the recommendations to stay safe and healthy when working with students who are unable to wear masks and need a person to be in close proximity to them. They could wear the overprotection, wear their masks. Do you have anything else to add to that? So the person who is helping that student needs to make sure that they get all of their gear on and that they are following the recommendations, correct?
What are your recommendations to stay safe and healthy when working with students who are unable to wear a mask and need a person to be in close proximity? So yes, again, I would go with the clothing over top, if you can have clothing over top. When they can't wear a mask, that might be a time when not only wearing my mask, I might have a face shield over as well, so that I have protection. In terms of being in close proximity, some of them you're going to need to be right there with them. And so trying to be aware of what's going on from the side, having the goggles that come along from the side can be more helpful than your regular just glasses. And I'm not sure, again, if the school district has those or if that's something you would need to get on your own. But we find those and are recommending those for when you're not sure of secretions in a higher risk area. Good hand washing for both that person and yourself by what they're touching and not able to wash. So you want to make sure that your hand hygiene is good as well. So there's not one great, this you must do. It's all of the little steps that help decrease the mitigation. It's your hand hygiene. It's wearing a protective outside kind of layer. It's not only using a mask, perhaps a face shield as well, and then good hand hygiene. If we didn't live in Alaska and when it gets colder, it's not as possible, but being outside or in a larger environment with good ventilation is also one other step of good mitigation that can occur. And so whenever possible to have those in a larger environment or outside with maintaining the ventilation within the building.
Also, one of the changes we made at FHP was we have outdoor picnic tables when staff are taking breaks and eating their lunch, and it's one person per picnic table. We have found that break rooms can be an area of major concern if people are sharing pizza or sitting close to each other. And so that's another thing to kind of just think about as things change going into this school year, how break rooms will be utilized, making sure that people are keeping social distancing and not sitting right next to each other with their masks off, and then eating food.
And that the one off from that is that One of the highest risk areas, as she mentioned, is in those time periods when you're not in front of the patients or the children in your case, that you tend to relax a bit. So when you're back in the faculty lounge or you're at the break room and you see someone who you've known and trusted for years, it's sometimes perceived kind of a level of trust and I respect you. I'm going to take off my mask and let's just talk because we're just two people here. And that is the message we want to have instead, is that I respect you and I trust. So I'm going to keep my mask on to keep you safe, because that is the time period when a good majority of things can pass from one person to the other, is when we let our guard down. Now, that being said, that can also extrapolate to what you're doing outside working hours. So in the number of months that we've had it here at FHP, one thing that we can say is that we have not had employee to employee transmission since we have started the precautions of universal masking and been aware of COVID since March. And that is because of the precautions that we are taking here in the building. The majority of the ones that we have had when we've had employees positive is what they're getting in the home situation or in the social situation. So one of the things that we're also asking is that as staff in the school district is to especially pay attention to what you're doing outside the hours, and also to trying to mitigate your risks outside, because what you bring back into the school could potentially be shared with others.
Okay.
We have we have another question in regards to gowns. Would it be better to wear a different one between students versus one for the whole day? One for the entire day would protect myself as staff, but not others around me when working with kids one-on-one in close proximity.
Okay, so let me reiterate. So when we work with patients, we change from patient to patient in that gown. What I was referring to is if you had a piece of clothing that you wore over the top to protect, and I'm talking about yourself. Depending on what, again, scenario you are in at school, you may or may not be provided a gown between each patient. I am not saying wear a gown, put it on the beginning of the day and wear the gown the whole day. We wouldn't do that, and that's not my recommendation. If you look at what we have, sometimes we have scrub tops that protect the clothes underneath, so that when we go outside the environment where it's a higher risk, then you might take that off. So depending on what the question is here regarding, I think someone who said they work with OTs who work that would be a decision that you talk about within your group, in your environment. What are we doing to mitigate risk? What do we have available to you? Do you have gowns? Do you have gowns enough? We have some washable gowns that we can use, and some of them are disposable. What do you have at your hands to make this the safest environment possible? We don't have enough for, I would imagine, in your environment to change with every single student you see, because you must see quite a number. But what can you do to mitigate to the best of your ability? So again, I am not saying put a gown on the beginning of the day, wear it all day long. When I was talking about wearing something at the end of the day, I was talking more over your regular clothes. If you're going to wear something, and then, but you want to be safe when you leave, then take that off, so you're not walking around with the same stuff you might have had all day into that outside environment when you're going to Fred Meyer's or you're going home or wherever you're going. So I'm sorry if that was not clear, but that was what I was trying to get across.
And there was a question from somebody, I'm not sure who it is, about resources for the school. I'll put it on the list of questions that we'll be looking at, but I can't answer that at this point.
So Terry, are there any other questions that you think that have been bandied about that we could answer for you?
No, I think that you have gotten them all. Let's see. So there was just a thank you for that one. And I think we're good for questions for today. Unless anybody has any last questions that you'd like to present.
Well, and Terry, the PowerPoint will be available, if you haven't made it already available, to all the people on the call. And then we do, at FHP, we do have a team who are available to the school district. And so if there are questions that come up, you can just let us know if we can help with any advice.
Okay, great. So if members on the participants on the call, if you have questions, send them to me, and then I can send them to Susan. So it's a really nice partnership that we've got going. Will shields be delivered to the schools, or do we fend for ourselves? I'll have to find out how the distribution is happening, but I believe principals have been made aware that there is, that we have those shields, so I'll find out.
Yeah,
So is there time for one more question for our medical experts? Yes.
Oh, what about N95 masks? Can we get those if they want?
Typing. Oh, she's typing.
Okay.
Can we get those if they won't sell? B, who are you talking to about that?
So there's a question, can you wash medical masks? And the medical masks, they're not indicated to be washed. The cloth masks is when I was referring to washing, I was talking about the cloth, but the medical masks are disposable and they're supposed to be for single wearing and then throwing out.
So B, and I'm not sure about if the N95 masks being able to get those, but I will put that on the list. Okay, I've heard different things on mostly social media about the buildup of bacteria on your face from long-term wear and use. I don't necessarily believe it, but I'd love to know the expert advice.
Buildup of bacteria on your face long time. So there have been reports of what's been, they'll call it acne related to long-term mask using. And their recommendations, the amount of hours that we're using is definitely different than when you have just the airflow on your face. But there's not something where that to my knowledge, that just by saying you're putting yourself in more danger by the bacteria that is on your face. So if the question is, are you at higher risk from wearing a mask from bacteria on your face? I would say that the answer is there's not a clear indication that to not wear a mask because of the bacteria that might be growing. There are different reports about increased number of acne that you can see in some people who never had acne before and now are reporting it. But again, not an indication not to wear a mask.
So the question, Trish, that you have is, should we share one shield? No. I will check to see why there was only one shield sent to Arctic Light, and my understanding is that we are sending those out. So I will double check and find that out, and we will get the shields out.
I don't know that answer. I don't know what that is. What about rebreathing your own CO2? Okay, so the question is, what about breathing issues, rebreathing your own CO2? There's been a lot of information and a lot of concern and political information go back and forth regarding masking. And so it is a very heated topic in some areas. Currently, the recommendation is for masks help protect those around you. It helps protect the community and keep the community healthy. And there are more and more studies that are showing it also has some effect to protect the person around you. The concern about increasing a individual's CO2 has not been one that has had the concern that that risk outweighs the concern and the benefit of helping a community stay healthy.
So Dr. Nace, I think I misunderstood a previous question. So this other one is quality and effectiveness of the KN95 versus the N95. KN95 more readily available?
I'm not sure what the question is, and I don't have the data that would tell you what the exact difference is between those. So that would be something you'd have to put on the tickle list to get someone to ask, but I don't know the exact effectiveness between the two. We only use N95, so I'm not sure of the data of the KN95.
Okay, great, thank you. And then there was one when you get a headache and get dizzy. What about breathing? Okay, so that was the CO2 and then getting a headache and getting dizzy. So
Okay, sir, is the
is
not
there,
question, but I'm going to guess it's like, what if you do feel symptomatic from wearing and feel like it's attributed to your mask? Then I would say that's a time to figure out where can you go in a safe place and remove your mask correctly and doing hand hygiene before and over and taking a breather. And so to that you want, we know the advantages of a mask, but they do come, they're not the most comfortable things to wear. And if you are having those kinds of symptoms, you need to find a safe place where you can, and you are socially distanced or preferably outside, can take it off and regroup and take those deep breaths, feel like you are more comfortable before you put it back on and go into your work environment.
and one of the things that I think I put in the chat before is if you're having issues, please talk to your principal and HR. Okay, any other questions before we sign off?
I think the last thing is, I would say is that what we're asking people and the staff and working with children is a huge ask. It's as essential workers, and you are essential. You're essential to getting our community back to where we want it to be. And it comes with a lot of stress. It comes with a lot of feeling of risk. It can come with anxiety. And for some people, it can affect them more than others. And so this is a time where we're really trying to support not only the students and the parents, but we're supporting each other as co-workers, and what we can do to help those who might be having more difficulties regarding their family situation, regarding their classroom situation, or their own personal health in that. And so this is a time to go that we all have a similar goal. We all want to get these kids back in and get our life back to what we perceive it was before. But we also want to balance that with keeping the kids, the staff, the community all healthy. And so this is a time to make sure you're also taking times to yourself, that you're also filling your own mental health buckets in the way, and by supporting those around you, as well as supporting yourself when you're outside the work environment, and making sure that you're doing what you need to rejuvenate so that you're better able to do the job that's being asked of you, which is incredibly difficult.
Oh, here's about reusing disposable masks. If you leave it on the sun, or have one for each week and then leave them in labeled paper bags.
So we're looking at one more question. It says, if we would like to reuse our disposable masks, what's the best way to do it safely? I heard you can leave it out in the sun, or have a mask for each day of the week, or leave them in labeled paper bags when not in use, basically waiting for the virus to die before the next use. Is that a viable option? I can say that the current recommendation is to use them once and put them away. But in this age, when we were using things, when they were less readily available, we were trying unique ways in which to reuse masks. There is no one way that we have that this is proven. They have study after study to show it's safe to be using it. And so the recommendation still is to use it that one time, and then the most safe thing is to throw it out. There are people who reuse their masks in the public setting. It's not something that we do in the medical setting here. I showed some different options. I don't know if you're on with this part of what we did with saving, and what these ones when I talked about the medical savings, these are the N95s that we were putting our N95s in here and saving them in case we got into a point where we needed to reuse them, when our options are no mask versus the N95. And by having them set for over that week, that we felt like that would be a better option than having nothing. And since we did not know what was the pandemic going to lead to in our situation, that is something that we set out to help save our PPE before we got in that circumstance.
Okay, so if your doctor recommended that, you could go with your doctor's recommendation if he doesn't agree with that and you agree with him.
So one of the things you're going to see out there is lots of recommendations. My doctor said this, my neighbor said this, my mom said this, the internet said this, that there's a lot of recommendations. And some of them, make sense to me that, oh, that could work. But when we're asking from an organization kind of what is the current recommendation, we are basing our recommendation on best practice and what the CDC says and what the guidelines say. There are different options that might possibly work, but we can't say with that assurity of, oh, this works because we've seen this study and this study and this study, and the conglomerate of medical advisors have said, yep, this is a safe thing, now do it. There are lots of little life hacks and different things that you could do that may potentially work, but until they're studied and proven and we have the medical support, we can't say, hey, that's a great idea, let's do it. But there are lots of little ways in which to manage that question up there. But in terms of the recommendation that you're going to hear, you're going to wait until we're going to hesitate to make those recommendations until we have the backing of the CDC or other organizations that say, this has been tested and this is the current recommendation. Carrie muted herself. So if there are any other questions or any other comments, Terry, now would be a good time.
Okay, thank you for unmuting me again, Susan. So are there any other questions, concerns? If you think of something later, please feel free to email me and I can pass those questions along to the appropriate people to get the answers. Yes, lots of thank yous for doing this meeting with us. And we so appreciate the time and effort that Susan and Dr. Nace put into this. And we look forward to continuing to partner with you.
Oh, Terry, looks like last question maybe about adequate sanitizing wipes.
Yes, I will put that on the list to see how to make sure the appropriate person gets that.
Well, thank you all for participating, and thanks so much for being part of our community and teaching and taking care of our children. And then Terry, you're going back over to your Google Meets, right?
We are done. This group, we're done.
Oh,
so
okay.
This was just an extra thing that they were able to come to today.
Okay, great. So it sounds like your team is able to sign off from here.
Yeah, so have a great afternoon. Thank you all for joining us for this presentation, and have a great rest of the day and enjoy the sun.